So now let's think about supplements and think about how supplements can be used in clinical application. Now, supplements is probably something that many of you are quite nervous about using when it comes to clients who are on maybe an extensive drug regime or an extensive chemotherapy regime. But first of all, let's talk about the supplements that are available out there, specifically those, with a lot of research or a lot of understanding behind when it comes to working with cancer. And then we can talk about how we can put a supplement regime together. And remember, everybody's individualized. And this is the thing, I don't want you to just think about that client has a diagnosis of cancer, therefore every client with diagnosis of cancer is the same. We all know that that's different. And we need to be thinking about that system approach, thinking about your functional medicine matrix and digging deep down into, that imbalance within that individual. So the first supplement that we're going to talk about today is SCAT. SCAT came about in the late 1800s when a Canadian lady who was suffering from advanced breast tumour. So she was going to die. She went out with a basket and she went and picked some local herbs from in her area and she brewed them into a tea and she drank it. She did meet a medicine man. He told her which herbs to pick and he advised her to drink the tea every day. She did, and she made a recovery from the advanced breast cancer. So the herbs she used is sheep sorrel, burdock root, slippery elmbank, and Turkey rhubarb root. Now, I still use SCAT in my clinical application today. From a taste point of view, I won't say it's beautiful, but I won't say it's, believe me, I get people to have things that are a lot worse off than that. So it's something that is part of. Therapeutically, I usually get people to have about a 50 ml serving per day. And you can buy this some of these are definitely not herbs I'll find in my back garden. Maybe weeds I'll find in my back garden. Antioxidants. Antioxidant, vitamin, mineral, and plant extracts have been increasingly highlighted as playing an important role in protecting the cell's genetic material and membranes from free radical damage, thus preserving normal cell reduction and all-round functioning. They're important in boosting immune function and resistance to infection. Most commonly used antioxidants are vitamin C, E, beta-carotene, zinc, and selenium. So let's talk about using antioxidants when somebody who's got cancer. Well, we need to split that down into two kind of subcategories. People who are on chemotherapy, and then people who have a diagnosis of cancer or you're working on cancer prevention. If somebody's on chemotherapy, you don't want to be giving them antioxidants during the active part of the chemotherapy regime, purely because the chemotherapy is about suppressing the immune system and the antioxidants are about modulating the immune system. However, you can get quite technical about how you can use supplements for somebody who's on chemotherapy regime, and that's looking at the half-life of the drugs. Now, we cover half-lives in the pharmacology lecture. So every drug, just like every nutrient, has its half-life. So it's the time it takes for half of the toxicity of the drug to be metabolized through the body. Now, if you look at, most people have a 3 chemotherapy or 2 chemotherapy regime. So if you think about estrogen-positive breast cancer, their regime is usually the FEC regime, FEC, and that's based around 3 chemotherapies. So what you want to do is look at the half-life of each of those drugs. Pick the half-life of the drug that is the furthest away, so that may be day 7, it may be day 9, day 14. So if we say the half-life of the third drug is day 12, okay? And they have a cycle every 21 days, which is quite normal with chemotherapy. So what I would say is no antioxidants. This is just an example. This isn't in gold dust. You must check out the half-lives if you want to look into this. No antioxidants from day 1 to 12. And you can then use antioxidants from days 13 to 21. Okay? So that's one way that you can use antioxidants in clinical application, is from the outset of the furthest half-life to the beginning of the next day. Now, beta-carotene is one. It was mentioned in a slide earlier on. You do not use beta-carotene when somebody is a smoker, and particularly when somebody is a smoker undergoing radiation treatment, because you are more likely to induce a secondary cancer. I honestly can only think of one incidence that I have ever used beta-carotene is a supplement in clinical application. And that was a young child who I did a vitamin and mineral analysis on them. They still had a high need for vitamin A, but due to a medical intervention in the past, I wasn't able to give them vitamin A during a 6-month period. So I used a beta-carotene, which was safe with this drug. It's the only time in all of my clinical experience that I have ever used beta-carotene. But I must put it out to you that, it isn't to be used with smokers, particularly smokers who are on radiation treatment. Vitamin A deficiency impairs immunity by preventing normal regeneration of mucous membranes, damage by infection, and by increasing the function of neutrophils, macrophages, and natural killer cells. Vitamin A is required in the development of both helper T cells and B cells. Vitamin C supports the phagocytic and cytotoxic activity of the lymphocytes and natural killer cells. Vitamin E increases T cell cytotoxic immune reactions. Higher serum levels of vitamin E are correlated with lower risk of cancer development. There's a specific type of vitamin E called vitamin E succinate. Sure, it's got 2 C's. It's not so widely available here in the UK, but it is very widely available over in the US. And this helps to reduce the blood flow to a tumour cell. So there's another reason why vitamin A, but particularly that type of vitamin E succinate. Destruction of cells by natural killer cells and production of interleukin-1, an immune-regulating protein, are 2 immune functions known to be zinc-dependent. Healing compounds in food. Researchers at the MD Anderson Center over in the US reviewed a variety of phytochemicals found in fruits, vegetables, and herbs to determine how they can treat cancer by influencing cell signaling pathways. By disrupting important cellular signals, these agents can potentially stop cancer cell growth, prevent angiogenesis, so that's the production of the blood supply to the tumour. Remember, if the tumour has its own blood supply, then it's fueled, it's ready to keep going. So we don't want that blood supply to be in place and cause cancer cell death. That's the apoptosis, that's the death of the cancer cells. They identified and studied a long list of therapeutic agents, including ginger, anethole, which is found in anise, and fennel, beta-carotene. The list goes on. Capsicum in chili, catechins in green tea, and we definitely want to be incorporating that as like a herbal tea, as well as looking at therapeutic intervention. Curcumin. The list goes on and on. You can read through that. The indole 3-carbinol, we've already mentioned that. The lycopene found in tomatoes, specifically beneficial for prostate cancer. Resveratrol, that was the one I mentioned in the red wine. But like I say, you need to drink a lot of red wine to get the therapeutic doses. You might be better off having it either as a supplemental or through more intense foods. Silymarin, found in milk thistle, which is both hepatoprotective and hepatorestorative. So you think of the bombardment on the liver, particularly by clients who are on chemotherapy drugs, then you definitely want to be thinking about what you can do to support them. Other immune-enhancing nutrients, coenzyme Q10. As a nation, we are CoQ10 deficient. Why? Because after the age of 50, 60, we all need statins regularly. Why? No, we don't. We need to be educated on a good quality diet. And what do statins do? They deplete coenzyme Q10 levels. So CoQ10 is a really potent antioxidant, but also it really supports the mitochondrial functioning and the energy transport chain. So without that, we're going to be back to those Tesco value batteries. No Duracell bunny here. Curcumin, derived from the spice turmeric, it's an antioxidant phytochemical, enhances the phagocytic activities of the macrophages in the immune cell, so gets the immunity working more effectively. Plus, it's anti-inflammatory, and inflammation is a driver of cancer, so we definitely want to keep that inflammatory burden down. Flavonoids, which are antioxidant nutrients, protect the body by stimulating natural killer cells and inhibiting critical enzymes that direct the inflammatory response. Garlic, we've talked about that loads. Green tea promotes repair to DNA and encourage apoptosis of damaged cells. Do you know, one thing I'm doing more and more with green tea now is if you make smoothies, so got to get your NutriBullet out, make yourself a smoothie, is instead of using water as the liquid as part of the smoothie, make a cup of green tea, let it go cold, and then pour the green tea in as the liquid. For many people, and I'll put myself into that category, I love herbal teas, drink loads and loads of herbal teas, really struggle with green tea. I just don't find it appetizing. I'll drink it from time to time because I know it's good for me, but it's another way to make your smoothie even more nutrient dense without necessarily getting the taste of the green tea. indole-3-carbinol, which are vital for the breaking down of the 16-alpha and the 4-hydroxyestrone to the safer sister, the 2. Also restores P21 gene, preventing synthesis of DNA for new cancer cells. We know that the P21 gene is highly associated with many different types of cancers. Lycopene's been shown to increase the cell-killing actions of natural killer cells. Melatonin. What do we know about melatonin? Melatonin is a hormone produced within the brain. We get a message because it goes dark outside. It sends a message to our pineal gland to say it's nearly time to go to bed, which then allows our body to release the hormone melatonin. The problem is, nowadays, we turn on the electric lights. We sit there with a bright light on our computer. So our body no longer has that correct circadian rhythm. And this is why it's actually really dangerous to teach children to go to bed with the light on. I'm thinking about babies with nightlights, young children with nightlights. Babies are never born scared of the dark. It was very dark inside of the abdomen. So actually what we want to do from a very young age is teach them to sleep in the darkness. Because as soon as we have a small amount of light, and that does include the numbers on an alarm clock, it disrupts our circadian rhythm. So as well as melatonin being helping with the production of melatonin and that circadian rhythm throughout the day, it's also a potent antioxidant. But even more than that, it's a tumor surveillance agent. So think of it like it's going around your body looking for potential tumor cells to pick up on. Mushroom polysaccharides stimulate lymphocytes and natural killer cells to secrete cytotoxins and interferon, which activate immune-mediated cytotoxicity. And resveratrol fights yeast and fungal growth, protects and repairs DNA, and kills cancer cells, preventing metastases. Astragalus. This herb enhances the cytotoxicity and activation of the natural killer cells and macrophages and protects against reductions in blood cell counts induced by chemotherapy. Now, what happens is, when you have chemotherapy, it often lowers your blood count. And this is why, before you can have the next round, this is why your chemotherapy is specifically detailed to be an amount of time far enough away from each other that it doesn't kill you, but close enough together that it can work on killing off the cancer cells. So this is why most cycles are, let's say, 21 days apart. If they were to do it less than 21 days, the cytotoxicity within the body would be too great that it could actually kill you. However, if you are going to be on chemotherapy, what we want to make sure is the chemotherapy is going to work. We don't want to be on cytotoxic drugs and them not be efficient. So what they do is they inject on day 1, and then they usually test your bloods on day 20 or 21. And then in theory, they go straight back to day 1. However, if your bloods, if your white cell count, if your neutrophils are too low, they won't allow the next chemotherapy to go on. And the reason for that is because if they then give you chemotherapy on this day, again, it could kill you because your immune defense is too low. You know, neutrophils are 0.0 or 0.1 is life-threatening. You pick up an infection, you've got nothing in order to fight that. If your platelets are too low, you could bleed out if your hemoglobin is too low. So, but if this day 1 is delayed to, say, day 4, day 10, or even the whole month is wiped out, then what's happening is these cancer cells are now getting the opportunity to grow again, getting the opportunity for that unregulated cell growth to take a hold. Think of it like antibiotic resistance, because that's what a lot of people understand. How many of you have had a course of antibiotics and then stopped taking them because you think you're well, and then all of a sudden the infection has peaked again? But then if you restart those antibiotics, the infection usually won't respond. Why? Because that bacteria has had the opportunity to proliferate despite those antibiotics being in the system. Does that make sense? Think of the chemotherapy. If the cancer starts to grow again, having already been exposed to, let's say, the FEC regime, but because your blood count's low, you've missed this whole month and your cells have metastasized, your cells have had undifferentiated growth again, then those cancer cells might no longer respond to the FEC regime. So if we are having chemotherapy, we want to have it at the schedule that has been researched to be the most effective, therefore every day, 21 days. So astragalus is a great intervention to help keep your blood counts up and therefore keep you on that regulated amount of chemotherapy as it should be. Echinacea stimulates the activity of macrophages, natural killer cells and lymphocytes, increases production of interferon and tumor necrosis factor alpha, and neutralizes free radicals. However, you must not use echinacea if you are immunocompromised, i.e. you are on chemotherapy. Oh, I lost my last slide. Pordiaco, which I usually use as a tea, has great antifungal, antibacterial, antiviral, and antimicrobial agents. It's really good for a parasitic protocol as well. And I usually use that as a tea. Do you know a great tip, because if anybody's drank Pordiaco tea, although I did come across somebody the other day who said they really liked it, I find it's very, very, very bitter, and I struggle to get clients to have it. However, if you mix a Pordiaco tea bag with another tea bag, say something a bit sweeter like licorice or cinnamon, then actually it counteracts the bitterness of the Pordiaco tea, which is a great way to get it in, because you've still got the therapeutic benefits, because you've still got the active herb going in. So beta-glucans have to be one of my favourite supplements that I use in my kind of cancer regimes. There's actually been some clinical trials done over at the Memorial Sloan Kettering Center in New York showing that beta-glucans even improve the efficacy of cancer treatments. So these have been used alongside conventional medication. Now, let's just do a little bit, let's just go into there a little bit about what happens if somebody chooses not to have conventional treatment. Well, first of all, legally, you cannot say a child is not going to have chemotherapy or radiotherapy treatment. If you, as a parent, chose for your child not to have that sort of treatment, then actually your child could be taken into social services, taken into social care, taken away from you. So a child is not allowed to opt out of treatment. As an adult, you can make a reasonable decision. Now, as a practitioner, I would never say to a client that you are not to go forward with treatment. All that I do is speak to a client. If they come to me and say, well, what would you do? Then actually, you could provide them with some research, looking at what you could do as to complement, what you could do to support, but you are never in the position to say, don't have the treatment. However, I've got many adult clients who have opted out of the conventional treatment and have made the decision to do it their own natural way. And I've had some very successful outcomes from that. So, but this is a trial that has been used alongside cancer treatments. Now, when I'm working with a client and say I want to put them on a supplement regime, the amount of them that say, consultant says I'm not allowed to take any supplements. So what I then give them the option of doing is for me to write to their consultant. And what I usually do is, because I've learned, over my experience of working with cancer clients, is I usually pick a couple of supplements out. And beta-glucans is definitely on that list. And then I provide them with some PubMed studies to show them how we can improve the efficacy of their treatment. And I write them a letter, and I bow down to their level of expertise and say, I don't say I know you're wonderful. What I say is I know that you are the primary doctor in our mutual clients. And what I'm trying to do is support the work that you are doing. And actually what I've done is done some extensive research on PubMed and come up with some scientific journals that have shown some phase 1 trials being used to improve the efficacy of your treatment. I might also talk about vitamin D supplementation and how, it is now being seen in the medical world that it is essential to have vitamin D at an optimal level to support cancer prevention. Now, I'm not saying it always wins, but I find that can be very useful in guiding us towards that, that optimal outcome of an oncologist working alongside of us. And medicinal mushrooms are a rich source of beta-glucans. Now, B17, has anybody heard of B17? B17, otherwise known as amygdalin, it's not a legal supplement here in the UK, although it is in different parts of the world, and is used in alternative cancer centres out in Mexico, out in Germany. It's a powerful anti-cancer complex, B vitamin. It's found in the pips of certain fruits, particularly of apricots. So in this country, the place that you can get it from is apricot kernels. Now, they need to be bitter apricot kernels, and they're the ones that should actually make your tongue go numb. And that are the ones that you should be getting the rich source of B17 from. What I will say is that they do have a high level of chemicals that need to be broken down in the body, cyanide. And what we need to make sure that we're doing is breaking down that cyanide. So just like a drug, cyanide has a half-life in the body. So I usually say to my clients, don't eat more than 9 in a 90-minute period. And that gives the opportunity for the half-life to break down in the body. But it's fine to be, actually therapeutic dose, if you're using apricot kernels, is about 60 a day. So what you want to be doing is kind of putting them in throughout the course of the day. Interestingly enough, research has shown that people from cultures eating a traditional vitamin B17-rich diet, like the Hunza tribe from the Himalayas, rarely contract cancer. So now let's take a look at what the medical route do. What's in their kit bag? And then we can look at what we can do to support our individuals. Now again, remember, all individuals are different. I would say I usually pick up clients at 3 stages when I'm working with them with regard to cancer. The first is most definitely the best, and that is, just been diagnosed with cancer, what can you do to support me? I've not had chemotherapy, radiotherapy, or surgery yet. I'm just talking through the doctor with the different options. It's definitely the best option because that's we can support them all the way through their chemotherapy. And I've had clients that I've worked with from that stage who've gone through chemotherapy with no infections, with no ill effects because of their changes to their diet. The second type of person that I usually get knocking on my door is those that have finished chemotherapy treatment or radiotherapy or they've had their surgery. And then they usually do this. And then they hold their breath, and they hold their breath because they're too scared to breathe again, because they're no longer having treatment. So what happens next? And that's, their fear gets in there, but now they want to work on preventing the cancer coming back. Third group of people, which is by far the hardest to work with, and the ones that, I get the least positive outcome with, is those that the cancer is back. Their cancer has reoccurred, their cancer is aggressive, their cancer is metastasized, and potentially the doctors have said there's nothing that they can do. And then they've come to me for a miracle. And like I said to you before, I'm not God. That doesn't mean that I don't think that I can not give them a better ending, or a longer period of time, or a happier period of time. And in those instances, I still feel as though I've done a good job. So, one of the first things that a medical doctor can do is surgery. So surgery is either diagnostic, so they're doing a biopsy on, a suspected lump or something they found on a scan, to remove the cancerous tissue, termed curative intent, so e.g. a mastectomy, prostatectomy, colon resection. So they're taking away the affected area, they're taking away the tumour, and they're also taking away the surrounding tissue to make sure there's no migration of those cancer cells. Or it's given palliatively, therefore to reduce, say, remove an obstruction within the bowel to make you a bit more comfortable. So surgical risks include bleeding, infections, thrombosis, damage to local tissue, reaction to anaesthetic, and potential spread of cells. So what can we do preoperatively to support our clients? So we know now that they're already going through it. If they're a smoker, we should encourage them to stop smoking. Increased quality protein is essential for wound healing. And we've already talked about what quality protein is, so we know what we're dealing with there. Reduce caffeine, although they can continue with green tea, which has got the active ingredient, the EGCG, in it. Nutritional supplements that may benefit: vitamin A required for endothelial and bone functioning. Vitamin C needed for collagen formation, proper immune function, and as a tissue antioxidant. Bromelain, which reduces edema and bruising. Arginine, which is shown to stimulate the immune system, enhance wound healing, and decrease rate of tumour growth. What I will say is you must always stop all supplements prior to surgery. Depends what supplements you are on and what surgical intervention you're having. If you're having a fine needle biopsy, where the risk of bleeding is very low, then you would only need to think about stopping 24 to 48 hours before. If you're having major open surgery, especially if you're on any supplements that increase coagulation, so fish oil, vitamin K, vitamin E would fall into that, then I would advise my clients to stop supplements 4 to 5 days before surgery. Then they've had the surgery, what can you do? Well, the first thing you can do is try and prevent them from eating hospital food, because the quality of the nutrients in hospitals is really not that great. So, if they've come in and they've got family with them, I say to the family what they can do to take in. Could they juice at home? Put it in a glass bottle and use a wine pump to pump out all of the air so that they keep the enzymes rich in the bottle. Homeopathic arnica is really good for getting bruising out. Immune system support, so medicinal mushrooms, so we talked about beta-glucans, immune system support, vitamins and minerals, juicing, prevent constipation, which is often a post-surgical complication, by making sure they've got adequate fibre and hydration going in there. So, chemotherapy and radiotherapy. Impact of orthodox treatment, the challenges to nutritional therapy. Well, it can often affect taste and olfactory changes. So all around sort of like the sinus area, can't smell food, can't taste food, nausea, loss of appetite, mucositis. I find this is a big problem. Mucositis is because chemotherapy destroys fast replicating cells. So that's tumor cells. Also affects your hair because hair is fast replicating. Your nails, some clients lose their nails as well because they're a fast replicating cell. But as are the mucous membranes, which go all the way from the mouth to the anus. So chemotherapy can destroy those mucous membranes, resulting in mucositis. I've had clients that can almost peel their lips off because the mucous membranes have been so badly damaged. If you've got a mouthful of intense mouth ulcers, are you going to be able to eat? Probably not. Dysphagia, organ dysfunction, bowel obstruction, malabsorption and leaky gut. Chemotherapy is a big driver of leaky gut. And electrolyte imbalance. So, types of use. Neoadjuvant, so prior to surgical procedure. So that's used to shrink the tumour and then it's surgically removed. Adjuvant, after surgical procedure, aim of reducing reoccurrence risk. So that might be thinking about sort of any residual cells in the area that are left behind. Salvage, that could be an aggressive form when other treatments have failed. And it may be that salvage chemotherapy, this is what we could refer to as high-dose chemotherapy. Now, high-dose chemotherapy is usually when people are in an isolation ward. They're not allowed people to go in without being gowned and masked. Whereas more these two, you might go into hospital on the day of your chemotherapy or stay in for 1 or 2 days, then you're home again. Palliative. This is where it's just literally giving you increased life. Now, often when people are put on oral chemotherapy, it's palliative. So, side effects of chemotherapy, nausea and vomiting, constipation, diarrhea, altered taste and smell, infections, mucositis, fatigue, lymphedema, so swelling, especially if like we've already had a surgical, so like a lumpectomy or a mastectomy, then we might find that we've got lymphedema down an arm or down a leg, and organ failure. Development of drug resistance, especially people who've had, numerous different types of chemotherapy, numerous different types of antibiotics. Increased risk of secondary cancers. Do you know that most chemotherapies can also cause other cancers? Persistent marrow suppression. And some people who have had chemotherapy, I never see their platelets going above 100. Infertility. Cardiac damage, persistent fatigue, and chemo brain. Where the brain just feels as though I can't process anymore. So if we're taking those down, breaking them down, think about what we could do. What's in our kit bag that we can use for our clients? So the first thing I'm thinking about is the mucositis, stomatitis, so, inflammation down the side of the mouth. Get dental care before starting treatment, if possible. So if there's time, always go and visit your dentist to make sure that there's no cavities, there's no periodontal disease. Although once you're on chemotherapy, dentists usually won't touch you unless it's an absolute emergency. Improve and increase oral hygiene, making sure that they're flossing, using a mouthwash, ideally an organic mouthwash rather than the chemical ones produced at the hospital. And again, what's key here is the likelihood of you having mucositis is quite high, so prevent it, don't wait until you've got it. Oral rinses, so aloe vera, liquid zinc, chamomile, slippery elm, LifeMail honey. LifeMail honey is an amazing type of honey that has specific cancer-fighting properties. It's a very expensive type of honey. You only need to sort of be looking at like a half a teaspoon a day, but it really helps with cancer-modulating effects. Trauma-LS. Trauma-LS is a homeopathic remedy. We struggle to get it here in the UK, but it is available to buy, if you search it through Amazon or something like that. I know I use it a lot in my clinic. And what I get my clients to do is add 10 drops of Trauma-LS to 10 mils of water and swish it around the mouth, trying to get all of the mucous membranes all the way around the mouth. and then swallow it, because then it's going to get the mucous membranes going down the throat. Now, okay, it's not going to get all the way through to the anus, but at least it's giving it a good start. And you know, with some of the children that I work with, they also get mucositis around their anal passage, and I get parents to, you know, same preparation, 10 drops in 10 mils of water, and then bathe their bottom with it. And you can actually repeat this up to 8 times in a day during your acute periods, but usually what I say is that 2 to 3 times a day during those less acute periods. And vitamin E, which if you buy a vitamin E supplement, you can just put a pin in it and then apply it topically to the sores at the side of the mouth. I will warn you that most vitamin E's are yellow in colour, so don't do that and then go out, you know, shopping, because, you know, you are going to get yellow staining around the sides of your mouth. Nausea. Ginger, freshly diced ginger root tea is, you know, a natural antiemetic. If you're feeling really sick, I'm not sure that ginger is the first thing you want to, you know, be thinking about. You know, you might struggle to get things down. So maybe using ginger tea from the day you start chemotherapy rather than waiting until, you know, you're feeling sick. Acupuncture, ideally the day before and day after each treatment. Maybe as a practitioner, you want to set yourselves up with an acupuncturist that you're happy to refer to. And then likewise, they'll be happy to refer their clients to you. Homeopathic remedies are Seneca album, Ipecac and Nux vomica. I find these two most beneficial for nausea associated with chemotherapy. And actually what I get my clients to do is buy both remedies and try them both, and then see which one works best for them. Taste changes and lack of appetite, be thinking about zinc supplementation, particularly liquid zinc. Bland, mild tasting food, and omega-3 fatty acids. Thinking about fatigue and that energy transport chain, coenzyme Q10. Rest as needed. You know, this is a time when clients do need to honor that rest times in their body. Exercise, goal is 30 minutes. I'm going to talk about exercise in just a minute, about what types of exercise. And L-carnitine, because what L-carnitine does is it helps to get the fats into the Krebs cycle, into the electron transport chain. And then thinking about insomnia, because like I say, chemotherapy really it does disrupt that circadian rhythm. So homeopathic melatonin, 5-HTP, a dose of 100 to 600 milligrams per day, and I'm actually known to get up to 800 milligrams per day. Make sure you advise your client not to take them with not to take them with a protein food, because they compete for absorption, but in fact to take them with a small amount of carbohydrates, so say like an oat cake or a small piece of banana, because that will aid transportation through the blood-brain barrier. Chamomile tea, after dinner, before bed, valerian tea, and relaxation activities. Switch off the mobile phone, switch off the electronic devices, put them to the side, and just really focus on winding down and some relaxation activities. Burning some essential oils, having a massage, taking a bath with some Epsom salts in it. They're all great principles for all of us, but, you know, especially in this circumstance because we're focusing on cancer.